Welcome back to Long Covid Doctor. As I said before, an educational series for sufferers of long Covid. This is the second part on headache and long Covid. In the first part, I talked about the symptoms, the diagnoses, the investigations, and a lot about the causes of headache in long Covid. In this part, part 2, I'll talk about the treatments, the management, and outcomes. References, links, and resources are in the show notes below. Any advice, diagnoses, treatments, as I mentioned in the previous part, in part 1, and I'll mention again, should only be considered after discussion with your own GP or qualified health professional. So here we go, part 2 on headache and long Covid. As I said, it's down to this next stage, which is all to do with the specific treatment and management of long Covid headache. So, firstly, any conditions or diagnoses that have been discovered through that thorough history and examination and blood tests will be addressed and treated. Maybe that's resulted in a specific medication or referral onto specialist hospital services. Having had the case listened to, the presenting symptom, the headache, and being given an explanation, the patient, hopefully, you'll feel validated and will have gained understanding and hopefully some reassurance about this. Reassurance that it's nothing that's not more sinister, like a brain tumour. It's part of your long Covid. And it's common, and that all that will have helped. But now onto the specific management of long Covid headache. It all comes down to the predominant symptom, the main contributing factor, the diagnosis. But broadly speaking, there are only a limited number of approaches for management of long Covid headache. For those patients with worsening pre-existing migraine, i.e. pre-existing underlying migraine, obviously we've got to treat that. So there's acute migraine, that's sort of sudden onset migraine that comes just out of the blue. And then there's chronic recurrent migraine. So the acute migraine, one-off migraine if you like, we'd be using sumatriptan, rizatriptan, sort of a dissolvable wafer, which a lot of patients like because you don't have to swallow a pill, remembering that acute migraine is often associated with nausea. And then there's chronic migraine. So basically patients who have migraine very frequently. For those patients who are having more than 2 attacks of migraine per week, those patients need to have preventative treatment, not just acute treatment when it happens, basically preventative prophylactic treatment. So what are those treatments? Well, the commonest and, if you like, the first line that we use, the first line treatment is amitriptyline. Basically, this is an old-fashioned antidepressant that came onto the scene like 50, 60 years ago, but we don't use it anymore. So I think it's important that whoever's prescribing this tells the patient that, look, it is in the category of antidepressant, but I'm not prescribing it to you because I think you're depressed. I'm prescribing it to you because we have found that it's very effective for preventing migraine. It's also a really good neuropathic drug. So against a drug that's used in chronic pain conditions, chronic pain syndrome. So neuropathic drug. So, like I said, it's an old-fashioned antidepressant. We have so many other really excellent, up-to-date antidepressant tablets. So we don't use them for depression at all now. And one of the reasons is not only because the new ones are more effective, but because amitriptyline can cause sedation. So often it is a medication we use instead of addictive sleeping tablets in general practice. We can use it for its sleep enhancing features. Its sleep enhancing properties. So 10 milligrams, that's the lowest dose, at night helps with sleep. So using it for preventing migraine, not good, because a lot of patients say, I can't take it because it makes me feel dopey. I have a hangover effect the next day. Don't like it. And then, so if you can't tolerate it, what else can we use for those patients who have frequent, more than twice a week migraines? Well, there's another drug called topiramate, 25 milligrams, which is an anti-epileptic drug, but used in this context for its migraine preventative features. If that's not tolerated, we don't like the sound of using that, then there's another drug, candesartan. Start low, 4 milligrams, maybe 2 if you want to be extra cautious. Candesartan is a A2 blocker. It is an anti-hypertensive, anti-blood pressure pill. But we have found it is good at preventing recurrent migraine. So, worth considering. The other medication which historically was used for migraine prevention was a beta blocker called propranolol, selective beta blocker. Again, it causes fatigue and heavy legs. Some people with an asthma, particularly brittle asthma, can't really take it because it can trigger their asthma. So again, more often than not, we don't use it as a preventer like we did in the old days. But if you haven't got anything else, it's still there if you should wish. You can get a slow release form of it. So those are the sort of the treatments for migraine. We talked about tension headaches, didn't we? Okay, so what can we do about tension headaches? Well, a lot of it is to do with tension of the shoulder girdle muscles and the neck, stretching on what we call the periosteum and the coverings of the skull. So you can have neck stretching exercises given to you by a physiotherapist, or manipulation of your neck by an osteopath, or even acupuncture, dry needling acupuncture. I used to do this in general practice. Found it very helpful for those patients who have a very tense one sort of band of muscles, usually the muscle called the levator scapulae. So dry needling that is very helpful. So it could help with tension headaches. I talked about anxiety and worry and stress causing tension headaches. Well, obviously we want to try and address that. So, if you've got anxiety or even depression, like I said earlier, we've got really excellent antidepressants. An SSRI called citalopram is probably the most commonly prescribed these days. Very good. You could use it as a short course to try and get over that sort of anxiety, deal with it. It's got a license for treating mild anxiety. Another antidepressant is duloxetine, which is some people find helpful. It's a drug we use for chronic nerve pain as well, neuropathic pain. Duloxetine. Some people get on well with it. Then, thinking anxiety and a bit of depression, maybe some counselling is going to help. Maybe CBT, cognitive behavioural therapy, is going to help. CBT, you learn the tools to deal with a symptom more effectively. No, I'm not saying that it's all because, I think that long COVID is all in the head. It is not, because there's lots and lots of evidence to prove that it's not all psychological. Definitely not. But CBT has a role to play with regard to managing symptoms, being able to cope with symptoms a bit better. So I've talked about anxiety, I've talked about tension, talked about migraine. And then remembering probably the commonest cause of chronic headache, the chronic non-specific primary headache. so-called primary headache. So really, it comes down to just tackling that with analgesia, paracetamol. But remember, one of the causes, we don't want to overuse that analgesia, that paracetamol, because you can get an overuse analgesia headache. Then you could use another headache pill, ibuprofen, an anti-inflammatory tablet. But again, be careful, because that can cause irritation on the gastric lining. So you wouldn't want to give that to someone who has sort of indigestion. For the chronic non-specific headache, there's no harm in trialing amitriptyline. I've said it's used as the commonest prophylactic preventative treatment for migraine, but there's no harm in trialing it for your chronic sort of primary headache. So those are the sort of conventional medication pharmacological treatments that we'd be considering for chronic headache. There are other sort of treatments, if you like, supplements that have some evidence base behind them, i.e. sort of backed up by some studies. There are 4 that are listed. There's riboflavin, so that's vitamin B2, So it's just a vitamin. So 100 to 400 milligrams once a day, sort of slowly increased in dose, can be helpful. And actually, it is in the NICE guidelines for headache. So it's, passed that test. There are rare side effects. It can cause a tummy upset and some diarrhea, urgency for passing urine, and weirdly, it can cause your urine to turn orange or sort of a luminescent yellow colour. So be warned, it can do that. So it's just a coloration. It's not causing any harm. It's vitamin B2, remember, it's only a vitamin. And then there's magnesium. Again, there's some evidence base. There's some studies to show that magnesium, as the citrate salt. There are lots of salts of magnesium which you can buy. There's the oxide and the chloride and the lactate and the spartate and the glycinate. These are different salts, but it's the citrate that is specifically helpful for headache. So make sure, if you're getting magnesium, make sure you get the right salt. Not surprisingly, the oxide is the cheapest. That's the one that's most readily available. That's the cheapest. But if you take that, it won't help your headache. Rare side effects of that, you can have some abdominal pain and some change and some diarrhea, some change in bowel habit. Just be wary of that. And then there's coenzyme Q10, 100 milligrams of that. Rare side effects, so again, crampy abdominal pains, can lower the blood pressure, cause sort of faint feelings, can lower blood sugar. So any new symptoms, when you take a new supplement, etc., you've obviously got to be on the lookout for, and if they happen when you start your supplement, stop the supplement. And then finally there's feverfew, a herbal remedy, 100 milligrams daily. So, but in common with all herbal remedies, we ought to avoid this if we're taking blood thinning medicines such as aspirin or clopidogrel or warfarin. So those are the sort of specific treatments for headache, both pharmacological and non-pharmacological supplements. But now thinking more specifically about the underlying long COVID processes, as mentioned earlier, the neurovascular problems due to all the dysfunctions and dysregulations and imbalances that SARS-CoV-2 causes that leads to long COVID. But thinking excessive inflammation, well, remembering one of the causes for that excessive inflammation is mast cell activation, which that can lead to triggering of the sickness behaviour response. It is an empirical off-license treatment with H1 and H2 blockers. So mast cell activation, MCAS they call it, mast cell activation syndrome, MCAS, is treated with H1 and H2 blockers. So H1 is an antihistamine, and H2 is an anti-acid tablet. So the antihistamine, non-sedating antihistamines such as cetirizine or fexofenadine, H2 blocker, famotidine, 10 milligrams at night. Both of those are being researched in something called the Stimulate ICP trial as we speak. So, yes, mast cell activation, think about that. Thinking about inflammation, I've talked about this more fully in a presentation on mast cell activation syndrome. So maybe look up that at another time. So, what else can we do to help recovery from long COVID? We've talked about recovery from the headache specifically, but what about the general sort of recovery from long COVID? We've got to take the overview, the holistic view. We need to think about aspects of that general holistic view on well-being, and that is nutrition and sleep, and thinking about mind-body strategies. Let's think about those in turn. So first of all, nutrition. Basically, a mixed, balanced diet, a Mediterranean-style diet, is what you should be taking. There are tons of diets out there, but a mixed, balanced diet, a Mediterranean diet, provides you with the minerals, the vitamins, the polyphenols. It gives you all that you need. It gives you the building blocks for repair, as well as the anti-inflammatory antioxidants, which dampen down inflammation. A Mediterranean diet will also give you prebiotic fibre to nourish the microbiota, the friendly gut bacteria that we have in us. Again, I talk about this more fully in my presentation on long COVID gut. But basically, we want a healthy gut microbiota, gut flora. So important for optimizing the immune function, so supporting the immune system, for vitamin production, for hormone production, for chemicals, so neurotransmitter production, all really important, and a consequence of a healthy gut microbiota. The other other dietary components which are really helpful are omega-3 fatty acids, fish oils, essential fatty acids, for immune support, supporting the immune system, but also vitamin D. No good self-respecting talk escapes the mention of vitamin D. Well, here we are. I'm mentioning it just for good measure. Yes, we all live in the Northern Hemisphere. We're all rather UVB starved, particularly in the winter months. And so vitamin D is important for immune support, as well as the omega-3 fatty acids and as I say, the mixed balanced diet. So taking a vitamin D supplement, no harm in that. It's going to be helpful for supporting the immune system. So that's diet and supplements. Sleep. Talked about, the holistic view for recovering from long COVID. Sleep's really important. As we all know, sleep is the great healer. What happens when we're asleep? We get refreshed and we get repaired. Our cells get repaired. So we must support that sort of day-night cycle, the circadian rhythm. I have if we can, a decent night's sleep. So for release of various restorative hormones that happens when you're asleep at night in the dark, such as growth hormone, the restorer. So we've got to think about sleep hygiene. We've got to think about strict bedtime, sleep enhancing novel to get you to sleep, or if you wake up, read it to get you back to sleep. Hopefully no mobiles or screens an hour before going to sleep, because they emit something called blue light, which is arousing, as opposed to reddish, dim red, pink light, which is relaxing. There are a few supplements you can take and medicines that you can take to help enhance sleep. I talked about amitriptyline earlier, didn't I? As a sleep enhancer, non-addictive. Certainly don't want addictive benzodiazepine, Z drugs. But Piriton, the old-fashioned Piriton, antihistamine, 4 milligrams at night, has a sort of sedating effect about it. Magnesium, not only is it good for headache, but is also helpful for sleep enhancement. And then there's melatonin. I should imagine you may well have come across melatonin. Basically, if you have trouble getting to sleep, 3 milligrams at night. There's a medication called circadian. Some people prefer the slow release one, which sort of works over the night. So sleep is so important to address, and again, like I've said before, I explained this in my talk on sleep disturbance in long COVID. Okay, so I've talked about diet, talked about sleep. What about sort of tackling those worries and concerns and, the turbo brain, particularly at night, and worries? These all lead to fight and flight and adrenaline and overactivity of the sympathetic nervous system. We should address these, and basically we should be thinking along the lines of mind-body techniques. So what do we mean by this? Well, there's sort of meditation, mindfulness. Everyone talks about mindfulness now, don't they? Well, there are studies to show that mindfulness is very effective at dealing with stress and brings you focus and focusing on the now. They talk about not then, not in the future, and there's a couple of apps, the Headspace app or the Calm app, which you can download onto your phone, relatively cheap, and you can have guided mindfulness sessions on a regular basis. And the studies show that if you do mindfulness on a regular basis, you MRI scan, brain scan studies show that it makes a difference in the actual the size of the brain in various places. So it's not just woo-woo. Mindfulness does have evidence base that biological changes do occur with regular mindfulness as early as 6 weeks of doing it on a regular basis. Only 20 minutes a day. Some people would say you should go to do 40, 2 lots to 20 minutes, 40 minutes a day. But 20 minutes a day, studies show that makes a difference. Whilst we're thinking about mind-body practices, what about yoga? And Tai Chi and Qigong. These are all, again, mind-body practices. Again, backed up by loads of studies to demonstrate that they're effective in stress and anxiety reduction. They incorporate focus and breath control and coordination, sort of general body conditioning. And finally, as part of the whole long COVID management, we ought to be applying the fatigue management strategies. And remember the 3 Ps: pace, plan, prioritize, to tackle fatigue. So expertly sort of coached by and taught by our occupational therapy colleagues. So pacing, the process of sort of awareness of your limitations, knowing your limitations so you can plan how you use your energy most efficiently and most effectively. Pacing basically means no more push through. It's time to stop. You've got to say, stop, that's enough, and save some energy for a later on. Stop, have a rest, save some energy. That's pacing. Pace yourself. I talk about this a lot in the session on long COVID fatigue. Might be worth a watch or listen. So, besides all this general advice, there are a couple of trusted resources for long COVID recovery. Your COVID recovery website, the NHS England website, self-help patient resource for symptoms and information and self-management. There's a link to that below. The Royal College of Occupational Therapists, I've talked about fatigue. They do an excellent presentation on how to manage fatigue. So that's certainly worth looking up. So there we are. That concludes the second part of my talk on headache with long COVID, following on from the first part earlier. I hope you found that helpful. As I mentioned at the start, any advice, diagnoses, treatments that I mention should only be considered after discussion with your own GP or qualified health professional. So in the meantime, I wish you well, and I wish you well with your long COVID recovery. Cheerio.